what are the different branches of ICU? Because if people think of ICU, they just think it's like a specific room, one specific room in a hospital. Could you specify what kind of branches there are in terms of ICU?
Oh yeah, I mean they're kind of right too, because in smaller hospitals and community hospitals, they only have one ICU, which is a medical ICU, and they tend to have like CCU, which is a coronary care unit. But they also fall in the category of critical care.
Right.
But if you go into bigger hospitals, like holding 400 or more up, 300 to 400 or up beds, they tend to have about 8 to 10 ICUs, I think, because we have cardiothoracic ICU, medical
Mm.
ICU, we have surgical ICU, which where I'm working at,
Mm.
pulmonary ICU, there's a neuro ICU, and liver transplant ICU, and also transplant ICUs. And there are some more, but I can't remember anymore. But those are the general ones.
Okay.
And if you have pediatric patients, they have like neonatal ICU and whatnot.
Okay. I think there was one for traumatic patients too. Is that right?
What's up?
Traumatic trauma.
Trauma ICU, yes, if your center has trauma center, if it is
Uh,
trauma center, which branches to like level 1 and level 2 and whatnot, then you will have trauma ICU. But it's usually, from my understanding, I've never worked at the trauma hospital before, but they will have trauma units, and then the patient will be transported to trauma unit, and then they will, once they're stabilized, they're sent to like ICUs. I don't know which branch, but I guess you can call it as trauma ICU.
okay. Then among the all those list of long many different
Hmm.
ICU types, do they work in the same unit, like same directory of the hospital, or are there like different like rooms dedicated for each
Oh, they're different units.
Okay.
So the place I'm working at right now, we don't have ER.
Uh-huh.
It's just solely for ICU patients,
I
basically.
see.
Yeah, we
Okay.
have more than 400 beds, so it's all separated. My unit has 10 beds, and also other units will have like either 6 beds or more than that, like 12, 16, and whatnot. It's all different.
All right. All right. Then we'll go to the next question. The second question is, how are the patient's families updated about their patient status? Because people usually think that they will be updated about their patient status within the ICU unit, but that's not. I think that's not always the case, as the patient's families might not be able to attend or visit their patients very often. Is there like
Mhm.
an alternative way that the like mobile phone or any other way that the patients can be updated by their status?
For us, when I did clinical rotation at Hoag, they
Uh,
had a little robot in ER, not in ICU, ER. They had a little
uh,
mobile device. It's pretty tall. It's about
okay.
like 5 feet and a half inches or whatnot. It just
Uh,
rolls around. It has a screen where they can talk to doctors. The patient can talk to the doctor on the screen. But in ICU, mostly before COVID, it all different. It's all different before COVID and after COVID, during COVID. Because before COVID, patient's family will come in, they'll be in
right.
the waiting room, and the will, doctors or residents or fellows will update them about the current condition,
Right.
especially after the surgery. But if the patient's been there for a long time, they can come in, and the way we do it, either nurses can update,
Mhm.
just giving the general information, how the patient's condition is, if the patient is okay with us giving the information to that family member. Or the best way we do is we do rounds in the morning time and then in the PM time. So around from 8 to 9, that's surrounding. That's where the surgical ICU team comes around,
I see.
and they do roundings on each bed as they go along, and then they'll talk about the whole plan and everything with the nurse, with the charge nurse, and also the primary care team, and then If the family's there, we ask them at the end of the meeting, we ask them, is there any concerns you have or any questions you have? And then if they have any questions or concerns about the current status, then we'll answer all the questions then.
Okay, I see. All right. Then what's the standard of deciding whether a patient should go to the ICU? How do you decide whether this patient should go to like intensive care unit or like a regular care unit?
So
Is
just
there like a
basic,
specific? Yeah.
just basic ICU setting, intensivists will have to decide, well, and as they talk to ER doctors, and then they'll decide which ICU the patient will be fitted in. But for us, a lot of surgical cases come in, and if they're hemodynamically unstable, then they will most likely stay in our ICU. If there was like one hypotension or like patient's blood pressure went down to like 70s or 50s during the OR case, then they'll immediately boost the patient's class from telemetry to ICU, right? ICU status right away. But the operating doctors will have to notify the surgical ICU team for us, like for the ICU team, and then we'll have to say yes or no. But the primary team does make the decision on that as well.
I see. Then my subsequent question is if patients that are, let's say, most of the patients I think that are going to ICU are post surgery or that patients that have gone into like a serious accident. Can
Okay.
patients without such symptoms or just like patients that are not threatened by their lives but have like an urgent symptom, can they still use the facilities in the ICU?
It
Are they allowed to use
depends.
it?
It depends.
Okay.
We try to say for us, like I said, we don't have ER, so a lot of cases we get are elective cases, like
Uh-huh.
surgery, or we get outside of hospital, like other hospital cases. If the patient's too sick and can't handle from that facility, they'll either fly the patient over or transfer the patient to our facility. And we try to save that bed as much as we can. So if the
Mhm.
patient is not if patient is fairly stable and can be managed or can be monitored in the telemetry unit,
Mhm.
then we will not upgrade the patient to ICU, basically.
I see.
Hmm.
Okay. So, how is ICU? How is the emergency care that is done in ICU different from other types of post surgery care in terms of like the equipments that are used? Like, how is the equipment? Is there any difference in equipment in ICU than other care units?
So you're talking when you say emergency care, you're talking about ER, right?
Oh, I mean, sorry, ICU
Uh-huh.
specifically.
So we we are definitely different. We use more um, complicated machines,
Yeah.
or we would have all the most of the ICU patients in our unit. They have a arterial line which reads blood pressure
Mm-hmm.
live, and also we can draw labs from there.
Mm-hmm.
So that's one of them, and that cannot be managed in the telemetry unit or telemetry floor or the med-surg floor. Whereas, and also we have like continuous renal replacement therapy, which is CRRT, which only the certified ICU nurses can manage on renal patients, like kidney failure patients. And also we have central lines that can hook up to monitor, basically, in a simple term, read the heart condition, how much the pressure that it has in each chamber. And there's like 4 different chambers. So usually read the right aorta pressure, and yeah, there are other cases where if you work in CTIC or transplant, like cardiothoracic transplant ICUs,
Uh,
they have a thing called ECMO, and they have a
oh
bunch
yeah.
of other like cardiac machines which I've never used. I've seen before, but I've never used it.
Hmm.
So those can be only dealt in ICU.
Okay. Is
Yeah.
this screening device also different? Like the devices that are used to like detect like clots, blood clots and everything? Is that different as well?
Clot
Like
like
I
clots in
mean
the
not
body?
clots. No, like I meant like CT scans or MRI scans. Are they the same or
They're the same. I mean, I heard that Cedar Sinai has a mobile CT machine,
I
but we
see.
don't. So we have to go to the CT downstairs. That's
Oh,
if
okay.
patient's stable enough, and MRI as
Okay.
well.
Okay. Then this is the next question. It is commonly believed that ICU is a place of isolation and grief, and people really tend to get terrified by the just by going to ICU. So my question is there like any way that ICU faculties kind of help the patients and their families feel better at ICU? Is there like a counseling system?
There's more. We counseling
Well,
system. I'm not sure about counseling system for the family,
uh-huh.
but as a medical team members, we try to resolve any issues with the social worker, and if there's
Mhm.
any like social, like monetary issues or any family issues within them, with that's the families and other patients involved, we
Mhm.
try to resolve that with social work or case
Okay.
manager if the patient will have to be discharged later and to
Okay.
figure out like which facility the patient's going to go. But in the meantime, when the patient's in the facility inside the ICU,
Mhm.
most likely it's the nursing staff and also the
Okay.
medical staff who are trying to comfort the patient's family.
Okay. So, well, in terms of USC, it's in specific, it doesn't have like a specific type of counseling program, right? But just non nursing staff and
We have counseling. I'm not sure if we have it or not, but we know
uh,
that we have counseling program for the staffs.
oh, staffs. Okay,
Yeah,
I
for
see.
the staffs. Yeah.
I think yeah, staffs also feel I think stressed within this facility. I think so. My next question is how the ICU is sterilized because sanity is really important in ICU for patient condition. So is there like a specific way that ICU patients and the rooms are sterilized?
Once patients vacate.
Oh yeah, like when there's no
Okay.
patient.
When we get the new before we get the new patient, they use we don't do the cleaning part. We have a EVS come in
Uh,
and clean. So they usually use chlorhexidine or peroxide. And if it is COVID patient, when
uh,
our unit was a COVID unit, we
uh,
use the UV light as well.
oh, okay.
Yeah, just to zap and kill all the germs, all the
Okay, so it
bugs.
really depends on the type of ICU and the disease, right?
Yeah, well, COVID is the exception, basically,
Well,
because
COVID.
COVID and also any airborne. Yeah, airborne we use the UV to
Okay,
zap.
okay. So for non-airborne diseases, so
Uh-huh.
what would you use instead of UV lights? Is it the ones that you mentioned
It's
before?
more like chlorhexidine.
Okay.
That's what they use. We don't clean the beds. I know some hospitals and nurses clean the beds. That's what I heard.
Uh-huh.
Um, but for us, yeah, the
Okay.
EVS take care of it.
I see. I see. Then how are the patients within the ICU monitored? Like because I know ICU goes on 24/7. So
Mm.
how do doctors kind of keep their eyes on so many patients at all times? I know the doctors go on rotation systems, but is there like a
Mm.
specific way you guys do it?
Doctors do go on rotation because we're a teaching hospital. Residents
Mhm.
are rounding
Oh yeah.
constantly. And also
Right.
fellows are basically supervising, and above the fellow, there's a attending physician.
Mhm.
But those, the nurses are actually close to the patients, and basically we're the eyes and ears for the doctors. And the way we monitor the patients is each room has a monitor
Mhm.
that's basically hooked up to the nursing station, and we have 10 monitors basically,
Mhm.
and it's all live feed, and we can see the blood pressure, heart rate, saturation rate, on the
Mhm.
respiration rate,
Mhm.
all at once. And also if there are more devices hooked up, like CVP or uh, PA pressure and all that stuff. We can just see from the what do you call it, the monitor. But
Okay.
if the patient is unstable, most likely one nurse will get one patient, and the
Mhm.
nurse will stay in the room all the way the
Oh,
almost whole time because patient's
almost.
unstable. Yeah.
Okay, but those nurses will get rotated over time though, right? Or
Every
do they
12
just
hours. I mean, we work 12 hours. 3 days
Oh,
or 3 nights per week.
I see.
So yeah.
Okay, that's interesting. Um,
Mhm.
then this question is relating to the current pandemic. Um, so within the current pandemic, I understand that the hospitals, especially the ICU, may not be able to accommodate all the patients that are coming. Is
Mhm.
what do the ICUs and the faculties do when the ICU units are full? Is there like any way to cope with it?
They will have to divert to different facility, but if the
Mm,
patient's unstable, because the way we got COVID patients is
mm,
through other hospitals,
mm,
and we were actually opening up. We actually closed our unit to transform into COVID unit, and
mm.
also we closed several telemetry units to transfer to COVID unit.
Okay.
Our hospital wasn't full, so we had
Mm,
enough beds, so we had full capacity. We were able to take more patients, but
mm.
just not enough were coming this time. But I know the other hospitals who were backed up with ER,
Okay.
some patients were staying in the ER, like out in the
Oh,
hallway. Yeah,
oh, in the
especially
hallway.
East Coast, it was really bad.
Oh, I see. Then
Yep.
can the patients also be transported to other hospitals if they're full? If that's also possible.
That's they can, but that's really risky because if the patient's unstable and
Oh
you
yeah.
transfer the patient and patient crashes during the transportation,
Okay.
that's risky.
I
So
see.
it's up to the physician's call, but I know that they were holding a lot of patients in the hallway because
Oh,
it was just hospitals were saturated.
okay. So they really couldn't like give equal care to all the patients, especially in the East Coast.
East Coast, especially New York area,
Right.
when they got hit with huge COVID.
Oh yeah.
Yeah, and here I know that some facilities were full and some had to be diverted if the patient was stable enough.
Okay.
Yeah.
Okay. All right. Then this is also adding on to the previous question. What role does the ICU play in the current pandemic? Is there like a specific role dedicated?
Yeah, because current pandemic is all about respiratory, right? So
Yeah.
patients get intubated and they had
Yeah.
to be manually proned. So if the patient cannot handle if the manual prone is not enough, then they'll have to go on a rotaprone bed, which it's a huge machine. You can look it up. It's a huge machine where
Uh-huh.
automatically turns the patient by the
Okay.
schedule. So you can set the
Oh.
schedule by every 2 hours, turning
Okay.
and whatnot. And and all the patients we have had COVID had to be ventilated. And the ventilation, there are different modes, but briefly,
Mhm.
like they had to be on the pressure support, and basically the vent has to breathe for them,
I see.
putting the pressure just to keep the lungs open so it doesn't collapse. Yeah,
Oh, I see.
but the pressures were pretty high on each patient we had, because
Mhm.
normal pressure for the uh, the patient for the every average people is like 4 to 5, but
Yeah.
they had to be on over 12. Some were on 20.
Oh.
So
Okay.
it's yeah, and that can only be managed in the ICU setting.
Oh. Okay.
And those
Then
are
you
really
would.
sick patients.
Okay.
Yeah.
Then you would consider a COVID patient like a patient with emergency care needed in the ICU, right? They're considered
COVID
like yeah for
COVID
COVID.
patients, you say? Sorry,
Yeah, COVID
can you
patients.
repeat the question again?
Yeah. So for COVID patients, are they
Uh,
considered? They're considered as like an emergency patient, right? As to be treated in ICU, or can they be treated in other facilities too?
Not all. I mean, all the facilities have ICU, but
Yeah.
not all COVID patients are unstable. Some of them are stable and some of them are not. So it
Mhm.
depends on your respiration. It really depends on the hemodynamics of the patient. So the doctor will have to, ER doctor will have to decide if the patient is suitable for ICU or not, because he does have to save beds for
Oh,
ICU, because ICU I mean, small hospitals, they only have like 10 beds in ICU or
okay.
20 beds in ICU. So it's really gets saturated quick, and
Oh,
you don't want to put just stable patient there and raise the bed, because
right. Right.
when you get a really unstable patient,
Okay.
you have to pull the patient out, and there's a delay of care. So that's what they have to decide on.
Okay. Then, because for specifically for COVID, patients
Hmm.
should be separated for further prevention of the transmission. Then, if the patients are placed in an ICU, do they get how do they get like separated from like normal ICU patients? Is there like a specific unit dedicated to COVID or?
There are COVID. I mean, so my facility
Mhm.
had the unit itself was negative ventilation, the whole
Okay.
unit,
Okay.
and plus we put a HEPA filter where it filters out
Uh-huh.
the bug.
Mhm.
Um, but because we were able to have negative pressure in our unit,
Uh-huh.
we were able to handle a COVID patient.
Uh-huh.
Right now, we don't have that many COVID cases in our hospital, so we only
Right.
have one unit that's dedicated to COVID.
Uh-huh.
So when we get the patient that's COVID patient, we put the patient in the room. I mean, every single room
Yeah.
is isolated in ICU.
Uh-huh.
You're just in your room by yourself. So we put them in. It has to be negative pressurized room. So we put the patient in, and we make sure the doors closed,
Okay.
and we have our own gears to wear and then go
Okay.
in the patient's room. Yeah.
Okay. Then I have my final and a more personal question, I think. Um, this is a question to really aiming to kind of enhance the public's perception towards the ICU. Do you have a specific instance that was memorable, especially in working as the ICU faculty? Can you describe one? Describe an incident in
Any
ICU?
incident, right?
Yeah,
Not just
anything that was
COVID.
meant COVID.
Um, for me, one memorable thing was, I mean, there are a lot of memorable experiences I had in ICU
Uh,
in my nursing career, but one that stands out is recent patient who had COVID.
mm,
We a lot of us took care of him, and we really thought he wasn't gonna make it because he was really unstable. He
yeah,
wasn't really tolerating the vent well and the treatment well.
yeah.
He was a tough patient, but
Hmm.
he actually made out. And then I saw a video of him that was taken by his, I think it was one of the family members, and sent it to us. He's now recovering, be able to walk with the
Oh,
walker. He's at the physical therapy session. There was this little session they posted and sent it to us. And when I saw that, I'm like, oh, you know, that's great.
yeah,
I feel
that's an
like
emotion.
yeah, I feel rewarded, of course, and I feel like I'm helping the patient and also family members out because he was really unstable back then,
I
but
see.
now he's able to walk.
Okay, so the moment you treated a COVID patient, I think that was especially
Yeah,
memorable and emotional.
yeah, that's the one because it's a recent event
Yeah,
that stands out the most. But I mean, there are other events, but it's the talk will go
it's
long.
the COVID. Yeah, because we're really unfamiliar to it. I think that
Mm-hmm.
really emphasizes how memorable it is.
Mm-hmm.
Then that actually concludes my interview. So thank
Mm-hmm.
you for supporting me out. And I do believe that this interview will really
Mm-hmm.
help the public, help enhance the public perception towards the ICU. And thank you.
Thank you.
Um,